Fast welcome to the Fertility Live webinar brought to you by AirAsia Health. And I'm your host today, Diana. And we have Vincent Gui, head of AirAsia Health here with us today. We would also like to extend a warm welcome to our guests from Alpha IVF, Siska Hernando and Dr. Lam Wei Kian, obstetrics and gynecology, subspecialized in fertility. Welcome and thank you for joining us. On today's agenda, Malaysia's top IVF expert, Dr. Lam Wei Kian, will be sharing about in vitro fertilization, IVF, and he will be answering most commonly asked questions about IVF. And later on, one of our own all-stars will also be sharing about her successful experience with Alpha IVF. So if you have any questions, please feel free to leave them in the comment section below, or you can just chat us in the chat box. So without further ado, let's welcome Vincent Gui, head of AirAsia Health. So Vincent, tell us more about AirAsia Health and this fertility campaign.
Hi, good afternoon, everyone. Thank you, Diana. I think first of all, thank you, Siskar, and also Dr. Lam from Alpha IVF for joining us today. This is our second webinar working directly with the Alpha Fertility. Can everybody hear me?
Yep.
Yep. Okay.
Yep.
So a quick introductions on AirAsia Health. So we basically launched AirAsia Health back in 2020, late 2020, November. What we're trying to do is to bring a better healthcare services or product, to the end consumer. Obviously, the borders are still closed. People can't travel. We basically open up to our local Malaysians as well to get a better accessibility and also quality care, right? Obviously, today we focus on fertility, so we just want to talk more about fertility. In AirAsia Health, we have 6 categories right now, 6 product and services. Fertility is one, right? Health screening, the annual health screening, or even a PCR test, and so on and so forth. We have aesthetic, right, for beauty. We have also wellness, and we have ophthalmology, and also TCM added recently. So these are the product and services that currently offer to local Malaysians and also to All-Star. And believe it or not, I mean, we are very particular in terms of who we want to work with. There are 260 private hospitals in Malaysia, but we don't work with all. We carefully selected those hospitals that have certain level of quality or accreditations, right? For example, JCI, for example, ACHS, or the fertility, accreditations from Australia, like what Alpha has gotten. So, I mean, this is important to patients because when somebody is seeking for treatment or procedure, obviously they want to look for, I would say, everybody has the same objective, is to look for the best, right? And or maybe affordable as well. So currently we have about 23 hospitals on our platform, and we have actually extended it to other markets as well. I mean, Malaysia being one of the top destinations for medical tourists to seek treatment in Malaysia, but you also have Singapore, you also have Thailand, India, Korea. Everybody knows they are famous of aesthetic, right? Hong Kong. So these are the 5 additional markets that we are going live by end of this month. So beside Malaysia, we also have other countries. Now let's focus, go back to Malaysia. So fertility is my passion, to be honest. I myself is a patient, and I gone through 8 years of how do I put it, challenges, stress, right? It is a couple's thing, but I also want to say that, I mean, more than often enough, you get a lot of stress from your family, right? Or family member, or relative, or your friends, hey, when are you going to get, have a baby or something like that. Now, this kind of stress, to be honest, I mean, I've gone through it 8 years and it's not easy. Try to ignore them, try to put it aside. What is important is the support of both the couple, husband and wife. You need to communicate and you need to support each other. I mean, infertility is not one person problem. It is both sides, right? So, I mean, the good thing is, well, the positive thing is we have the best, I can vouch for that. We have the best center in Malaysia, Alpha IVF. I did 3 times of fertility treatment, and my 3rd time was with Alpha, and I only had 1 embryo to transfer, and it was successful. And my son is 3 years old now. So, continue to support each other and do not, never ever lose faith, and continue to dream. And you have the best expert from Alpha IVF to assist you, and I'm sure everybody that is going through infertility would have done what I've done as well. Do a lot of research and study, and try to find out the best hospital, best doctor. Trust me, I've gone through it, and some centers obviously offer much cheaper, but there is a reason behind why they are more affordable, right? The decision is that whether you want to fail your first time, second time, and then go to the best hospital, or you want to get it right at the first attempt, right? I think that is really important, so you don't waste money. If you look at it, it is much more affordable if you go to the best hospital and seeking the best from the professionals, right? So, I mean, I don't want to talk much. I'll leave it to the experts, Dr. Lam and also Siska, to share what they can offer to the consumer or the infertility couples. Yeah. So that's all from my side. Thank you, Diana.
Thank you, Vincent. That was really touching, because I'm also on my TTC journey right now. So thank you so much for your sharing. So next up, let's welcome Siska Hernando from Alpha IVF. How are you today, Siska? So
Hi,
can
hello,
you tell us
Diana.
more? Yeah,
Yes,
tell us
I'm
more
good.
about Alpha IVF.
Yes. I'll be sharing more with everyone later through our slides. But of course, then, thank you very much to AirAsia for having us today. And thank you very much for selecting us to be your partners in the fertility treatments provider. And I'm really honored, as what Vincent mentioned earlier. You select only the best one to be in your platform, and we are really honored for that. So in Alpha IVF, I can vouch for you that everything we do, we really strive for excellence. So you want to know more about this, I will share with everyone later about who we are on the brief journey of us, how we come to today. And of course, then later, Dr. Lam, who will be in our sessions later, he will share with everyone what are the technologies that we adopt in order to help high IVF success rate in those patients that come over to our place. Right. So let me share my screen. Okay, can you see my screen?
Yeah, we can.
Good, yeah, all right. Okay, all right. So if let's say you have not known who Alpha IVF is actually, right? Our story start from many years ago, way many years ago, since 1994, when my founder, actually Dr. Colin Lee, founded Damansara Fertility Clinic back in year 1994. So at the time, the setup was very small. Then after that, subsequently, the center emerged into a bigger one, to Damansara Fertility Center, and then subsequently into TMC Hospital. And after that, it was divested, and then the proceed, we start up with Alpha Fertility Center in year 2011. And after that, we keep on expanding until today. Here we are in year 2021, located in Kota Damansara at the Strand Mall, better known as Alpha IVF and Women Specialist. So there's a lot of fertility centers outside in Malaysia over here, and also international platforms. So what makes us so special? Right. So for Alpha, very much we are focusing in the innovations of technologies as well as research and development. I can probably share with everyone that up till today, we have been actively involved in the research and development areas where my teams has, the embryologist team has come up with more than 200 plus scientific papers published. Frankly speaking, for a private setup, in order to be actively involved in research and development, it is not easy because you need a lot of data. You need a lot of patients that give you that kind of data for you to do the research. And on top of that, the time that you need to put through it and the effort. So for us, this research and development is one of the areas that we always want to pay attention, because through this research and development only then we will always be able to innovate new ways so as to be able to help our patients to achieve another higher level of IVF success rate. Because all of us know until today, there is no guarantee that IVF will be able to give you 100% success rate. But we can always try to close the gap closer and closer, from 70 to 80 to even in the future maybe 90%, until we can able to close the gap even closer. Right, so up till today, we have recorded more than 3,500 live births that we have reproduced to our fertility treatments. And through the team medical expert that we have more than 60 years combined years of fertility experience. So, okay, services that we provide in our centers, of course, the core services are the fertility treatments such as IUI, IVF, ovulations, inductions, and such. This is the core of the services for fertility treatments. However, for these core services, we are able to expand further into more advanced fertility treatment services where we can combine with pre-implantation genetic testing. You know, nowadays, even virus will mutate whatsoever about our human genes and all that, right? There are so many hereditary diseases that available that actually through IVF we will be able to avoid it. For instance, thalassemia, a very commonly found diseases in Southeast Asia. So with IVF and pre-implantation genetic testing, we will be able to avoid passing on this disease to our next generations. Aside from that, of course, then we also do egg freezing, where women that more like, let's say, career-minded, that have not found their Mr. Right, or even for patients who is down with cancer and they are undergoing chemotherapy, and they will be able to preserve their fertility by freezing their egg or even their sperm, and then after that they can continue with their treatment and continue with their parenthood journey after that. Aside from that, we also can do sperm donations program, egg donations program, as well as embryo donations program who are in need, and also savior sibling program. This savior sibling program is something more advanced, where to put it in a simple form, for a family who have, let's say they have a son or a daughter down with thalassemia or even leukemia, they can have another sibling where we can use their cord blood, derive the stem cells, and use it to treat the elder siblings so that the disease can be cured. This is to put it in a simple way. Of course, in the way where we do the process or the fertility journey, it will be much, much more complicated. However, these are all that we can do, even beyond. Okay, so why Alpha IVF? Now, for our center, we have recorded or documented high IVF success rate of up to 82.9% through the utilizations of the advanced technologies that we deploy in our center currently, and we never stop that. So later on, my Dr. Lam, he will share with everyone on what are the latest and advanced technologies that we deploy in our center in order to help our patients. In fact, for these new advanced technologies that we adopt, even last year, where everyone is still in the dormant positions because healthcare was totally hit very hard last year during the pandemic strike, but we never stopped that, and we continue to be innovative, where we introduce our latest artificial intelligence, as well as the OVA PRP, which is the ovarian rejuvenations using the platelet-rich plasma injections. And artificial intelligence, I don't need to explain a lot. A lot of time, it's already very much ingrained in our life. You use your handphone, you can scan your face, and then after that, you can unlock it. Those are artificial intelligence, and it is now being applied into the treatment of fertility. Right. We have proven track records of numerous groundbreaking fertility achievements. This one, you may find that it is a bit boasting. However, all our achievements are recorded in conferences that we attend. Either we present it, we submit our papers, or we what do you call that? It is recorded in the journals. So like the high IVF success rate of 82.9%, it is actually one of the papers that we submit in one of our conferences or congress back in year 2019. Okay, forefront of fertility treatment technologies, as I mentioned earlier, on the technologies that we always bring up front in order to help our patients to achieve high IVF success rate. A lot of time, all these technologies we would start first because we are very active first, like I mentioned earlier, in the area of R&D. So we are very much in touch with the progress in the industry. What are the latest technologies that people have been using so that we will be able to adopt all these and help the patients that come over to our place. First class facilities, we are the current space that we have just moved in. Everything is tip top, and we do the setup as per the international standard. Real success stories that have traveled far and wide, I will share with everyone later in the next slide. Leading team of fertility specialists. Okay, these are the achievements that you can, if let's say you want to know more about it, you can browse through our website. I shouldn't go further into it. The new technologies that I have already mentioned earlier. And as I mentioned just now, the success stories that have already traveled far and wide, these are actually one of the family that came over to our center where their original country is from Mauritius. So this couple somehow or other got to know about this Savior Sibling program that we offer aside from our fertility treatment. So they are actually both thalassemia couples where they unfortunately have the first child that is down as a thalassemia inherited, and this boy need to undergo a routine what do you call that, dialysis or blood transfusion, sorry, blood transfusion. So they somehow got to know about us, and then they came to us. So they were here throughout the entire pandemic time until last year, about November. They finally succeeded delivering a healthy baby where they will be able to use the cord blood stem cell and derive the cord blood and derive the stem cell to cure the sibling. Otherwise, the sibling have to go through a regular blood transfusions, and this subject the baby, the what do you call that, the patients to some side effects because of the regular blood transfusion. So with the siblings that we help and deliver out, they will be able to cure the sibling. The beauty of this part is that if people were to embark on the Savior Sibling program without the technology that we have, they probably have to go through different kinds of tests, and the sibling may not be the exact accurate to be the donor to the elder sibling. However, with our technology, we are able to offer this, we term it as definitive high resolutions HLA, meaning that, to put it in a simple way, the embryo that form up from the IVF treatment is exactly the one that will be able to match the stem cells for the elder siblings, right? So last year, November, they delivered successfully the healthy baby. Then subsequently, they will proceed with the stem cell treatment to cure the elder brother. The other one, of course, I don't need to mention a lot. This is Dato Sri Siti Nohaliza, where her IVF treatments are also successful at our center both times. The second one, of course, he just delivered about 3 months ago. Right. For our fertility specialists, currently we have 5 fertility specialists with us. We have Dr. Colin Lee, who is our founder, Dr. Leong, Dr. Haris, Dr. Lam, and also Dr. Tan, who all of them are actually on board with AirAsia Health. When you come and purchase your fertility packages with AirAsia, you will be able to have an appointment with any one of them. So aside from our team of doctors, of course, we also very strongly backed by our scientific board members, where these are the towering personnel, international level, where their works in the IVF industries have gained a lot of reputations. Take, for example, Professor Emeritus Bruno Renenfeld. he is actually the one that invented the injections where the people who are undergoing IVF need to use the hormone injections where they inject every day. It was the one that invented. And after that, we have Professor Emeritus Alan Trounson's, the one that have the first IVF successful pregnancy. And then Dr. John Keefe, who is the one that created the manual to train the embryologists in the lab, and Dr. Masashige Kuwayama, the one who is the pioneer of having the most used cryopreservation technique, and also one of the technique called Cryotec that is able to yield 100% post-toe survival rate as we thaw out the blastocysts or the embryos. Okay, so this is our team. It was taken last 2 years before we were struck with the pandemic. So everyone was so happy. I just can't wait to have this moment again where everyone can enjoy happily without masks, where we can be close with each other. Right, so without further ado, that's all are the topics, the slide that I shared with everyone about Alpha IVF. And the next, I will just leave the time to the host and also Dr. Lam, who will share with everyone the technologies that we use in order to yield a high IVF success rate. Thank you.
Thank you so much for sharing, Siska. That was very insightful. We will come back to you on the available packages after Dr. Lam's session.
Right.
Next, we would like to welcome Dr. Lam Wei Kian. A little bit about Dr. Lam. In 2016, Dr. Lam Wei Kian graduated with a master's in obstetrics and gynecology from the prestigious University Malaya in Kuala Lumpur, Malaysia. In 2018, he completed a postgraduate German UAE diploma in in vitro fertility, IVF, and reproductive medicine. Dr. Lam will be sharing on IVF treatment for infertility, advanced technologies for high success rates. If you have any questions for Dr. Lam, please feel free to leave them in the chat and comment section below. So Dr. Lam, you may begin.
Yeah, thank you, Diana, and thank you, AirAsia Health, for inviting Alpha IVF to participate in this wonderful regarding the health journey. Okay, I'm Dr. Lam. I'm from Alpha IVF fertility specialist. Now, I would like to share about a bit of regarding our technology in our center. All right. So first of all, I would like to define what's the definition of infertility. So infertility, if the woman is less than 35 years old, inability to conceive after 12 months, so we will label the woman is infertile. Or the woman more than 35 years old, inability to conceive after 6 months, we will advise the woman to come to confront and look for the doctor for assessment. This is a gender distribution of the infertility, because last time there is a myth, every infertile causes must be due to the female factors, but this is not true. So statistically, the causes and gender distribution of the infertility can be divided into both party, meaning that male and female. From this pie chart, you can look at the male part. It can contribute about 30%, meaning that almost one third of the gender distribution is caused by the male factor. The other 30% is due to the female. 30% is a combination of male and female, and the rest 10% is due to unexplained infertility. For the female infertility, for women aged 35 to 39 years old, the chance of conceiving spontaneously is approximately half of the women aged from 19 to 26 years old, meaning that the younger you are, the more fertile you are. So don't delay your fertility treatment or consultation until you are more than 40 years old, because the chances for you to have a spontaneous or the IVF treatment is getting lower when your age advancing. The natural cumulative conception rate in the 35 to 39 year age group is around 60% at 1 year and 80 to 85% at 2 years. So from this chart, we can show that the fertility properties is going to downhill after the woman more than 35 years old. Indirectly, the spontaneous abortion is start to increase after 35 years old. That's meaning from the definition I given just now, we use the 35 years old as a cut-off point. So if a woman after 35 years old, the properties of the fertility will drop dramatically. So this is a repeat. After 35 years old, there's a decrease in the ovarian reserve and increased aneuploidy. Aneuploidy meaning that the abnormal of the genetic contents of the embryo. That's why the spontaneous abortion rate is higher after 35 years old. Of course, there are other factors associated pathology with the woman tends to have the womb problem, the abnormal growth, such as the fibroids, the endometriosis, that can impact the ovulation and the egg quality of a woman. Irregular ovulation due to the hormonal changes, hormonal imbalance, or the woman has some previous surgery that will affect the ovarian and uterine function. That's all those factors will contribute for the fertility point of view. Okay, the other part is the male infertility. Male infertility is getting more common. We are able to observe in our clinic consultation. So most of the male infertility, we can divide it into the 5 categories. First of all, the male cannot produce any sperm because it's due to the testis failure or some obstruction, meaning that the sperm cannot be ejaculated out. Secondly, the husband can suffer from the low sperm count. Low sperm count meaning that we call oligospermia. The definition for the low sperm count is less than 50 million per mil of the semen analysis. Or the male suffer from the poor sperm motility. Motility means the movement. The movement is less. So the sperm unable to swim through, the cervix to meet with the eggs in the fallopian tube. Next is a morphology problem. Morphology, the shape of the sperm, meaning that the head, the neck, the tail of the sperm are abnormal. Then we can reduce the fertilization rate. Lastly, the sex difficulties. Maybe the male has some ejaculation problem or some erectile dysfunction. So this is the picture to show that the abnormal sperm. This is a head defect. This is a normal sperm, the head, the neck, and the tail. This is a head. You can see that it's a bigger or abnormal shape, irregular shape, or double head. This all is the abnormal morphology. The acrosomalus, because the DNA contains lesser. The mid-piece defects the neck. You can see irregular shape. The tail defect, can you short tail, the coil tail, or the kindred tail. So all those abnormality of the shape of the sperm can affect and reduce the fertility. Okay, usually the male is very straightforward. Male, by doing the semen analysis, we can identify the problem that I mentioned. The semen analysis, we able to analyze the sperm count, the sperm morphology, and the sperm mortality. Then we can give you a conclusion. The inability to conceive is whether due to the male factor or not. Of course, there's other causes can reduce the male infertility. This includes the sexual transmitted disease, the diabetes, obesity, hormonal imbalance, the exposure to the toxic or the heat, or some direct trauma or injury to the testes. The treatment, usually we advise the male to have a lifestyle change. Lifestyle change such as smoking, because most of us are aware that smoking did reduce the quality of the sperm. So reduce smoking, reduce stress, exercise, dietary. Secondly is a supplement intake. Usually the supplement we recommend to the husband to take is the supplement consists of zinc, selenium, arginine, and the coenzyme Q10. So this is in order to improve the quality of the sperm. If the husband has some issue of the tubule of the testicular problem, we can go through the surgery to rectify the problem. Or from the surgery, we can retrieve the sperm out, then to use for the IVF treatment. Okay. First and foremost, fertility assessment on both husband and wife are very crucial and important. As I said before, the male very straightforward. In lifestyle, in our life, male is always very straightforward. By doing the semen analysis, then we will know whether the problem is arising from the male factors or not. For the semen analysis, we're able to find the parameters of the sperm quality and quantity. For the female is a bit more technical and more complicated because it involves a lot of blood tests, hormonal tests, and some scanning to identify whether the female got any fertility problems or not. So we'll perform a pelvic vagina scan to find the overall condition of the two things. We look at the womb and look at the ovaries. The womb, we look at the womb got any abnormality, any abnormal growth, the lining is good or not. For the ovaries, we look at the ovarian reserve, how many eggs the woman still have, or any abnormality detected, such as the abnormal cyst, abnormal growth over the ovaries. So the abdominal scan also is important to find out other problems as any cyst or any polycystic ovarian syndrome or any endometriosis. After that, if you need to do a further investigation, because by doing the routine scanning, we are unable to pick up any tuber blockage, meaning that the blockage over the fallopian tubes. We need to do a HSG, we call it hysterosalpingography, to investigate the patency of the fallopian tubes to see the tubes got any blockage or not. By doing this simple, like an X-ray procedure, HSG. We advise the woman to do some blood test if indicated. Okay. Next, after we concluded, then we will give a thorough plan how to improve the fertility property for both parties. So first of all, you need to have a lifestyle changes, to take some medication, hormonal therapy, or to perform the surgical procedures. If the couple suffer from infertility, not necessarily the first treatment is for IVF. There's other methods we can do to increase and to maximize the fertility properties. So as if the woman to have polyps, the uterine polyps, we can do some daycare procedure to remove the polyps. Then we can directly increase the fertility properties. You have a fibroid, we remove the fibroid. If the woman suffer from the tube problem, so of course we advise the woman for the IVF. So we need to treat every couple differently. Not necessarily you come to our center, straight away is IVF is a treatment we offer. We need to see what the issue, what's the problem the couple suffer from. Okay, besides IVF, we do also offer the treatment we call the intrauterine insemination. We call it IUI. Okay, IUI basically is a procedure. We take the sperm of the husband, then we directly inject the sperm inside the womb of the woman. Then we can increase the success rate of mimicking the natural conception, because it's like doing some shortcut. The sperm no need to swimming by itself from the cervix, vagina, going through the cervix into the uterine cavity. From IUI technique, we directly put the sperm inside the uterine cavity. That's a IUI procedure. Okay, next, this is a flow chart. I think it's a diagram. It's showing some egg freezing. I think everyone should familiarize the term of the egg freezing, meaning that you freeze the eggs. Okay, who's the target group for the eligible for the egg freezing? Okay, I will divide it into three main group. The first group, if a woman is still concentrate on their career, on their studies, they still got no other times to think of want to give birth. So for those women, in order to they want to keep and freeze their younger age group eggs, they can opt for the egg freezing. Okay. The second group is for the woman to have some personal circumstances, such as they haven't get their Mr. Right yet, or their partner are not ready to have a baby. They want to postpone or delay the, the baby plan later on. But the woman also worried if the age is more than 35 years old, the quality of the eggs, the number of the eggs will start to drop. So in order to keep the younger age eggs, egg freezing is the option. Okay, the third group of the woman to need to think of the egg freezing for those who have some cancer or they need to perform the chemotherapy or radiotherapy before they want to perform those special treatment. They can proceed for the egg freezing first, so that all the subsequent treatment won't give any harmful impact to the egg quality. So this is basically the journey of the egg freezing now. Initial consultation, do the blood test and scan, follow up. So the doctor will begin the treatment for the egg freezing cycle. Then we do the egg retrieve. The doctor will start to monitor the progress. Then we start the injection to boost off the eggs. Then we trigger the eggs. We do some daycare procedure to retrieve the eggs. Then the eggs will be freeze immediately after we retrieve the eggs. Okay. This is a diagram to show that the IVF, the normal IVF journey. All right. So this is also starting for the consultation. Then the doctor will give a specific individualized treatment plan for the couple. Then the couple will start with the IVF journey by starting the injection. I think every woman listen at the injection is very scared because today the injection all come with very improvised, all the very modern. So the injection pain is very minimal. So the doctor will do a scan to monitor the egg growth. Then we do a procedure to retrieve the eggs. Then the eggs will send to the embryologist to grow the eggs to the blastocyst. Then we do the embryo transfer. Okay. What are so special for the Alpha IVF? Because every center do have their special strength. What is so special about Alpha IVF? That Siska mentioned just now, we can use the high IVF success rate. Okay, we do have some latest, the only we call the exclusive technology that's only available in our center. So it's the OVA PRP. OVA PRP is a new technology we just launched in the last, I think it's less than a years, to regenerate the ovarian function. Okay, this one we explain, elaborate further on. This only exclusive in our center, only in Alpha IVF. We do have this kind of the technologies in Malaysia exclusively. The other thing is a Microsoft. Microsoft also the other technologies only available in Alpha IVF. The Microsoft meaning that is a sperm sorting technique. Because if a couple want to choose to have a family balance, to have a baby girl or baby boy, they want to increase the chances to get a desired embryo with a baby boy or baby girl. By doing this Microsoft, we can help and increase the chances of getting it. The other is a pre-implantation genetic testing, Cryotec embryo freezing, artificial intelligence also is exclusive technology in our center. Next is a endo trial. A trial test is a formerly previously we know as a ERA, EMA, and ALICE. ERA is a meaning that we find the window of implantation that is specifically for the woman, meaning that we do the transfer that can yield the higher success rate of the implantation period. Because by doing the ERA, we can identify the window of implantation of that particular woman. Lastly is the Embryoscope and the Time-Lapse monitoring system. So what is OVA PRP? OVA PRP is intended to regenerate the ovarian tissue, stimulate the vascularization in order to improve the blood supply, and finally awakening those dormant eggs into maturation. Meaning that if the woman has a very poor reserve, poor response, repeated poor IVF outcomes, or the maternal age groups is getting more than 40 years old, or the woman has a premature ovarian insufficiency, also we benefited from this technology. ORPRP basically is just to take some blood, allow 15 cc blood from the woman. I think I have a video to show here, to draw out from the woman. Okay, after that we centrifuge and we process the blood sample by our embryologist. This is our chief embryologist Adele. So we centrifuge and choose the platelet-rich plasma, one of the component in the blood that have a high growth factors. Then after the process, we're going to use the PRP. We inject into the ovaries of a woman by doing some decay procedure. Okay. By doing that, the ORPRP, we can improve the ovarian function, meaning that to improve the quality of the eggs produced, to improve maybe the numbers of the eggs. We do have some patients who have underwent this ORPRP. So far, the result is very promising. Okay. Next thing is exclusive technology, is the Microsoft, just like I mentioned, to choose the sperm carries the X or Y. Because it's a fact, the sperm is to determine the gender of the baby, not the woman eggs. Okay, let's say the sperm, because sperm has carrying the X gene, the sperm carrying the Y gene. If the Y gene mixed with the X, it become a baby boy. If the sperm X mixed with the X, it become a baby girl. So in order to get your desired baby gender, by doing this sperm sorting, we can increase the likelihood of us to get the sperm gender of your desire lah. If you want to sort for the baby girl, it's on 50% to 88%, for baby boy from 50%, can as high as 74%. The other technology we deploy in our center, we call a PIEZO ICSI. PIEZO is like a robotic technology in our lab to use for the intracytoplasmic sperm injection. This is a conventional ICSI. This is the eggs. So in order to make the eggs fertilized, we need to put a sperm inside. So this is a conventional ICSI. You can see this is a pipette, is a very sharp end. We pierce through the wall. Then this is a sperm. You can see the sperm is flowing. Then we injected the sperm inside. This is a conventional, the standard. But in our center, we use a PIEZO ICSI technology. You can see the pipette, the tip is very blunt, it's not sharp, so it less harmful effect to the eggs. Then we press through, the pressure is more even, so it won't cause any harmful impact to the wall of the eggs. Then we inject it inside, then we inject the sperm inside and let the fertilization to occur. By doing that, we can minimize damage to the eggs, we can increase the fertilization rate. The next technology in our center, we call Embryoscope plus Time-Lapse monitoring system. So conventionally, the old-fashioned one, we put in the incubator. Every day, the embryologist will take out the valve of the embryo to analyze whether the growth of the embryo is good or not, how many cells obtained. But nowadays, with the introduction of the embryoscope, meaning that all the embryo starting from the day 0 or first day, we already put inside this machine, the blue machine. Inside the blue machine, there's a 24 hours tiny camera to capture the growth of the embryo, meaning that the embryologist no need to take out the valve from the incubator outside to the under the microscope to monitor the growth of the embryo. With the embryoscope, the embryo will remain undisturbed for 24 hours until the day 5 or day 6. So the lab error, the human error, the changes in the temperature, all we can minimize in order to improve the embryo growth and quality. You can see from the 0, you can monitor until the day 1, the division of the cells to the 4 cells, 8 cells, and subsequently to the blastocyst at the day 5 of life. You can start to compare. See this? So this is a blastocyst. Blastocyst is the day 5 embryo. In addition, in our center, we also have a Cryotec preservation technique, meaning that we want to do a frozen cycle. We freeze the embryo. We can assure all of you, our track record is 100% survival rate for the embryo of a blastocyst during the vitrification or the warm process. Meaning that if you want to thaw out the blastocyst for the transfer, we can assure you 100% of the blastocyst still survive and 100% the quality remain intact. You give me the good quality, when you thaw out, it will remain the good quality. So it won't reduce the survival rate of the blastocyst. This track record has been published in OGSM and all the Congress, the Malaysia Congress. This is a pre-implantation genetic testing. Nowadays, this is we call a third generation of the IVF, meaning that before we put in the embryo, we're able to test the genetic or chromosome, whether it's normal or not. There's a few category of the PGT, called pre-implantation genetic testing. We can check the chromosome is normal or not, is fit to 23 pairs or not, or we can test whether the embryo do carry some abnormal genetics, such as the thalassemia, that we can identify and notify. Next one is any chromosome structural derangement. We also can detect by doing the PGT testing. Lastly, just now as Siska mentioned, we do have the case that has both parents also has a thalassemia carrier. So in order they want to get a HLA compatibility for the living, for the eldest son, for the stem cell transplant later on. Before we transfer the embryo, we will identify and know whether the embryo is compatible to as same as the genetic or the HLA record leukocyte antigen is compatible with the elder son or not, or elder bladder or not. So if the baby is born, then we can use the baby stem cells or the bone marrow for the treatment for the elder bladder later on. So these pre-implantation genetic testing for the aneuploidies, we test for the 23 pairs of the chromosome. The last pair is a sex chromosome. So it's a monogenic disease. We choose a thalassemia. We can identify whether the embryo do carry the thalassemia gene or not before we do the transfer. The AI is artificial intelligence enhanced embryo selection. We do collaborate with the Life Whisperer. Our center is very honored to be selected one of the center to participate this AI technology. So far, our center already got 4 cases by using the AI technology to select the embryo for the transfer. So far, all 4 of the cases also can give a good result, meaning that all beta positive, meaning that all women get pregnant as using the AI technology. Okay, this is a summary. There's advanced IVF technologies that in our center deployed to use a higher IVF success rates. Lastly, as I mentioned, is an endo trial to identify the window of implantation of the woman. Inside the trial, we can do the one test. We can test for 3 things. One is the ERA, the window of implantation. Secondly, we can check the microbiome. Microbiome meaning that we check the Lactobacillus, the germs inside the womb, whether it's adequate or not. Thirdly, we can check whether the womb got any underlying infection or not, that we need to treat before we do the transfer. This is our track record for the world-class high success rate. This is a publication since 2016, 2017, 2014. So we can give a plastration rate up to 82%. The implantation rates are 79.5%. Clinical penetration rates are up to 82.9%. And we use a Cryotec preservation, the Cryotec freezing technology. We can use a 100% survival rates. Okay, that's my sharing for today. Okay, thank you.
Thank you so much, Dr. Lam. That was a really an eye-opening sharing session from microsort, egg freezing to blastocyst. I definitely learned a lot today. We really appreciate it. This is really useful for someone who is on a TTC journey like myself, and I'm sure for other All-Stars as well. So before we start with Q&A session, we would like to hear more about the IVF packages available at Alpha IVF. Siska, will you share more on that?
Hi, sure, Diana. Okay, I do have some packages that we put on board with AirAsia Health that I would like to share with everyone. Oopsie. Just a moment, yeah. Okay, can you see that?
Yeah, we can see it.
Okay, so after hearing all the sharing by Dr. Lam, probably some of you may get confused with so many advanced technologies as well as all the medical jargon that you have already listened, but that's okay. If let's say you are in the journey that trying to conceive and you are considering IVF treatments and etc., don't worry, leave all the care and the worries to us, and we will help you to journey through your fertility treatment so that you can be you can experience as a parent as well. So here we have already equipped you all with a few packages that is because Vincent tell us that Siska give us the best deal that we can offer to our patients. So we also would like to help couples to achieve their dreams. So here you go. We start with this one. For people who are considering egg freezing, you can get this egg freezing package through your AirAsia Health platform for 18,000. Bear in mind that all these packages that we offer to you are not available when you walk into our center. These are all exclusively available only for only when you purchase to the AirAsia Health platform. So egg freezing package for 18,000. Fertility assessment for husband and wife for only 300 ringgit, inclusive of the semen analysis, the transvaginal scan, and the doctor's consultations, as well as the nurses counseling session. Alpha Double Deal IVF FET, where you have, in short, this package will allow couples to have several chances in just by paying by one price, 49,800. You have 3 chances, whichever chances that come first, whether transfer 3 times come first or the IVF cycle 3 times come first. And after that, the new package that I just make it available through your platform is the special IVF deal package, which is for one-time trial until the embryo transfer, which is a complete cycle for 25,000. This one is by fresh transfer. If you would like to upgrade to frozen embryo transfer, you can top up with 8,800. For the details and the terms and conditions, you can either ask us questions in the sessions letter, or you can go to AirAsia Health platform to check out on all the information there, right? So that's all my sharing for this, and then I pass back the time to our host, Diana.
Thank you, Siska. So we have a few questions here from the audience for Dr. Lam. So the first question is, how long should a couple wait before proceeding with IVF if they are both healthy?
Dr. Lam, you are muted.
Yeah, you are on mute.
Sorry. So if the couple is healthy, usually we give time for the couple to try on their own for at least 12 months. If still unable to conceive, we advise the couple to come to our center to have an initial assessment first. As I mentioned, there's a lot of causes that can contribute to the infertility. Maybe the causes just a very mild causes that can be rectified by doing some simple procedure, such as to remove the polyps or to remove the cysts. Then after that the fertility property will be improved. Then the couple can conceive naturally without resort to the IVF treatment. But you need to have an initial assessment first. If the couple are trying very hard, very eager to want a baby, we advise after 6 months of trying, we can come to the our fertility center to have an assessment.
Okay, thank you. Another question is, how long does one IVF cycle take?
Usually the IVF cycle, it takes about a month. We give you 1 month duration. Okay, nowadays we use the regime, meaning that at the moment of the woman to have a first day of the period, then we need to start the injection, meaning that the injection to boost all the eggs to grow. Usually the injection take about 2 weeks. After the all eggs are matured, then we proceed for the day care procedure to retrieve the eggs. After the eggs, we do the ICSI, the laboratory, or the workout to grow until the blastocyst stage. Then we do a fresh blastocyst transfer 5th day after the egg retrieval. Then 10 days later, we wait for the result to do a beta ECG to confirm the implantation and the pregnancy. So the whole process takes about a month.
Okay, there's a question here from the audience in the Zoom call. Are there chances of miscarriage if you go through IVF treatment?
Yes, the chances of miscarriage still can happen if you perform the IVF, but the chances is lesser compared to the natural process. Depending which technology you use in IVF, because IVF, just I mentioned, if you do a normal standard IVF treatment, meaning that we just grow the blastocyst until the 5th day without checking their chromosome, meaning that without doing the PGTA. By the outlook, we know that it's a blastocyst, we straight away transfer in. The chances of the miscarriage is same as a general population. For those who resort to the PGTA, meaning that we check the chromosome of the blastocyst, the chances of the miscarriage is lesser because all the abnormal blastocysts we already excluded. It's not our paradise to do the transfer. There's a first screening process being done. So the chances of the miscarriage, if you perform the IVF with PGT testing, the chances is lesser compared to the general population.
Okay, thank you, Dr. Lam. One final question. I'm also curious about it. Does the IVF lead to twins and multiple birth?
Okay, because last time you heard about IVF, this one IVF and can have a twins, can have a triplets, or some center they have a quadruplets, meaning 4 baby. Okay, that is I think it's not fair to the mother who carrying the twins or triplets or quadruplets nowadays point of views. In our center, we will promote to transfer a single blastocyst, meaning that the mother to carry 1 baby. The chances of the 1 blastocyst to split into 2, we call a split twin, is only 3% only. The chances if you transfer 1 blastocyst, the chances the mother to carry the twins is less than 3%. Unless the mother insists want to transfer 2 blastocysts, then if 2 blastocysts also implanted, then the mother will carry twins. No? It
see.
all depends how many blastocysts to transfer during the program. Nowadays, we in our center we doesn't recommend to transfer more than 2. Maximum is 2.
I see. Okay, thank you, Dr. Lam. I have a question for Siska. Is couple eligible to use EPF if they want to go through the IVF process?
Yes, yes, of course. Jiska.
Yes, correct. Just to support on Dr. Lam's side, yes, couples can now use EPF to fund their fertility treatment. So what they do is actually they come over to start their fertility treatment first, and the claim to the EPF is through reimbursement. So when they are at our center and they complete their cycle, then we will help guide them through with all the the necessary paperwork.
I see.
Thank you.
Either Dr. Lam or Siska, one final question. Why should couples opt for Alpha compared to other IVF centers in Malaysia?
Let's discuss answer first.
Okay. Of course, I would say that every fertility center also will try their best to give their treatments and services to help couples to become a parent. All of fertility centers, our objective is the same. We just want to help couples to become pregnant. But of course, in our center, we do have our advanced technologies that we use to support couples in order to have high IVF success rate. And those are validated, but validates through our high IVF success rates. And we are also very actively involved in our research and technologies, where we are in the front line of having all these updates to increase high IVF success rates. Other than that, there is no 100% guarantee on that. We will try our best to help our patients to achieve their dream to become a parent. Right, thank you.
Thank you so much, Dr. Lam and Siska Hernando, for joining us today on this session. And we really appreciate it. So before we move on with our next session, we want to say goodbye to both of you. If there are more questions from our all stars, where can they ask, or who should they refer to from Alpha IVF?
Come again? You mean refer to when they have questions and all that?
Yes.
Oh, you
like
can
if they have more questions.
Sure. You can always email to us or inquiry to us. I will send it through the chat over here so that you can be recorded.
Okay. You can share on the chat.
You can share to everyone later. Yeah.
Yes. Thank you so much, Siska. Thank you so much, Dr. Lam. We really appreciate your presence today during this session, and we'll definitely get in touch with you.